We each write history, we write it every day, but it's always the present that I'm interested in, and even more the future. I think the future can be formed if one has the courage and the willingness to plan for it.
How do we continue to imagine better health? We do it by always looking forward, by drawing inspiration from our past. CHI St. Vincent has a rich legacy. Today, that legacy is in our hands, and we proudly carry it into the future. Our health system has always had a higher purpose, a mission to deliver more than just physical care. We bring our communities the whole picture of health, mind, body, and spirit, carrying out our mission to extend the healing ministry of Jesus. Today, CHI St. Vincent welcomes more than 1 million patient visits a year, caring for people from all 75 counties. With 4 hospitals, a comprehensive ambulatory campus in West Little Rock, and an extensive system of specialty and primary care clinics throughout Arkansas, we deliver better care so our patients don't just imagine better health, they live it. It's an ambitious mission, and it would go nowhere without our people, the caregivers who bring our ministry to life. Thanks to their compassionate, inspired care and commitment, we're nationally recognized by U.S. News & World Report as the best hospital in Arkansas for the 3rd year in a row. We're also the first hospital to achieve magnet recognition for excellence in nursing. In the realm of specialized care, we're widely recognized for our neurosurgery program, which ranks in the top 100 in the U.S. Dr. Ali Krish, director of Arkansas Neuroscience Institute, is among the top 1% of neurosurgeons in the nation. ANI is known for its surgical expertise in craniotomies and is a world leader in performing and training other neurosurgeons. As a result, ANI has patients from 35 states and from 4 different countries. We are also the destination for nationally ranked orthopedics, a program that features all fellowship-trained surgeons and the 8th largest spine program in the United States. In Hot Springs, our CHI St. Vincent Cancer Center is accredited by the American College of Surgeons Commission on Cancer. CHI St. Vincent is home to one of the most sophisticated cardiovascular facilities in the country, a program led by top cardiologists and cardiovascular surgeons in the state. The Cath Lab at the Jack Stevens Heart Institute is the state's only ACE-accredited lab for cardiovascular excellence.
This year, our cardiovascular team improved the length and quality of life of 60 Arkansans suffering with valvular disease, performing minimally invasive transaortic valve replacement known as TAVR. Our surgical group did more than 1,600 cardiovascular procedures in the last year alone. We are also establishing a heart failure clinic to improve the quality and length of life for hundreds of patients suffering with the late stages of heart failure. We are constantly striving to advance the level of care for our heart patients.
This year, the Infirmary also became the premier GI program in the South and the only hospital to utilize the digital spyglass technology, which diagnoses and treats pancreatic cancer. We're now equipped to perform the most advanced endoscopic procedures previously only available at large, out-of-state facilities. And while these incredible achievements are noteworthy, it bears repeating that they would not be possible without our extraordinary staff. These are the people answering the call to create a healthier Arkansas.
In medicine, we have science and those type of things, but there's another very important component to getting better, and that's the faith-based element. And I think of all the things that we do and the way we operate, faith is at the top of what we do here. It's not money, it's not those type of things, it's faith and it's healing people. And there's a lot of power behind that.
I've received freely from Jesus, and I want to give that back freely, and I want to walk with patients and families when they're in their scariest and some of their hardest moments here at the hospital. And for me in the ICU, just to walk with them in that in the same way that Jesus has walked with me through my tough and my scary moments. It's such a vulnerable place, and I just want to be present and be there.
Caring for the elderly and kids, or just having compassion for them has always been sort of part of me. And so being able to work at a facility where our number one goal right now is to care for the poor and vulnerable, it gives me so much pride and joy and fills my heart.
I've been through a lot growing up, and I was in a bad car accident in 2012, and I was in a coma. So just coming to work and working with the patients, blessing them as they bless me, it touched my heart. And I love touching their spirit because the smile that I get from them, it's marvelous.
Over the past few years, Americans have seen dramatic shifts in the healthcare landscape. Looking ahead, we know the current healthcare delivery system has to change. Healthcare today is too expensive, not coordinated, and unsustainable. Reimbursements shifting from volume to value. We're leading the way by ensuring that we're delivering value to the communities we serve. Nowhere is this new thinking more evident than the CHI St. Vincent Arkansas Health Network.
To improve healthcare in Arkansas, we are uniting our physicians, our hospitals, and other providers to focus on the patient first. Today, Arkansas Health Network has over 1,200 providers with coverage across all of Central Arkansas. Together, we manage the care of more than 50,000 people, making us the largest accountable care organization in the state. By creating an integrated network, providers can greatly increase the efficiency and quality of the care we offer. Through better coordination, our goal is to keep people out of the hospital and be there for them if they are hospitalized and follow up with them after discharge. These are new approaches for Arkansas, but we are already seeing the successes. This past year, Arkansas Health Network was the first certified Medicare ACO to achieve this goal. We reduced the cost of care for 10,000 Arkansans by $4 million. This success reinforces our commitment to create a healthier Arkansas.
The Arkansas Health Network is a shining example of our new way forward, but it's not the only one. This year, we partnered with Conway Regional to form the Arkansas Health Alliance. By partnering with independent community hospitals and healthcare systems, we bring value by increasing efficiencies and help keep healthcare local. The ultimate goal is to improve the health of the rural populations across the state. Healthcare is more than just healing the sick. That's why we're leading the way by investing and growing outside our hospital walls. A perfect example is our growing West Little Rock campus, where we're providing more access to outpatient services like imaging, primary care, and urgent care. But that's just the beginning. We have to continue to expand our focus on prevention and wellness. We know that Christ has no body but ours, no feet but ours, and no hands but ours to carry out His healing ministry today. Our life is a life of service. We're called to meet the needs of the community today, and I ask for your support in expanding our healing ministry. CHI St. Vincent, together we can imagine better health.